Hello and welcome. And when you see me here, it matters health. And today I want us to discuss a very important topic that affects both men and women, and that is high blood pressure. If you're new here, please consider subscribing to our YouTube channel, that is Doctor on Wheels. You can also subscribe to our social media platforms, that is Zawadi Premier Hospital _ Ngong for the Instagram, and Zawadi Premier Hospital Ngong for Facebook. So before we start, I want us to start with some words of wisdom from Romans chapter 5 verse 8. The Bible says, "But God demonstrates his love to us, that while we were still sinners, Christ died for us." So let's dive into it. So what is high blood pressure? Or what is hypertension? So hypertension is persistently elevated arterial blood pressure. Okay, so if your pressure has been persistently elevated for quite some time, it can lead to damage to essential organs in the body. So if it damages the brain, it can lead to stroke. If it damages the heart, it can lead to heart failure or even heart attack. If it damages the kidneys, it can lead to chronic kidney disease. And then if it damages the liver, it can lead to liver failure. So hypertension can be classified into two. We have what we call primary or essential hypertension, and then we have what we call the secondary hypertension. So primary or essential hypertension is accounts for around 95% of all the cases, and the cause to this type of hypertension is not yet known. Okay, so it is idiopathic. And then secondary hypertension, it accounts for around 5% of the population, and you can pin it down to a specific cause. That is patients who have chronic kidney disease, okay, adrenal tumors that lead to excessive production of adrenaline, okay, patients who present with sleep apneas, okay, patients who are obese, okay, patients who have hyperthyroidism, and also patients who use certain certain medication, can actually present with hypertension as a result of these conditions, okay. Now, hypertension can also be classified into what we call optimal. The optimal is the preferred blood pressure, and that is blood pressure, systolic blood pressure of below 120 millimeters of mercury for the systolic, and below 80 millimeters of mercury for the diastolic. And then we have the normal, okay, which is between 120 millimeters of mercury to 130 millimeters of mercury for the systolic, and between 80 and 84 millimeters of mercury for the diastolic. And then we have the high normal, which is between 130 millimeters of mercury to 139 millimeters of mercury for the systolic, and 85 millimeters of mercury to around 89 millimeters of mercury for the diastolic. And then we have the hypertension, and hypertension basically will be anything above 140 millimeters of mercury for the systolic and above 90 millimeters of mercury for the diastolic. And then we have hypertensive crisis. So hypertensive crisis is anything above 180 millimeters of mercury for the systolic and above 110 millimeters of mercury for the diastolic. Now, who are the people who are at risk of developing high blood pressure? So number one is the aged. So as people age, they basically have an increased risk of developing high blood pressure. Number two is family history. If you have a family history, there is any close relative of yours who have had high blood pressure, you are also at an increased risk of developing high blood pressure. Number 3 are patients who are obese. So with obesity, it comes with deposition of a lot of fat, okay? So this fat can be deposited in your blood vessels, and then those blood vessels become narrower and narrower, and that one can actually predispose people to, or obese people to high blood pressure. The other risk factor is sedentary lifestyle. So basically, people who don't do any kind of exercise, or they are just seated, they don't do any form of exercise, so physical inactivity, okay, can actually predispose you as well to high blood pressure. And then the other risk factor is smoking. So the cigarette has a toxin called nicotine, and this nicotine can actually settle in the blood vessels, okay, so in the inner lining of your blood vessels, and it will make those blood vessels to be hard, so they will not be elastic. They cannot expand and contract depending on the pressure of as the heart pumps, the pressure that is transmitted from the heart. So basically, it means then you are at risk of developing high blood pressure. And then last but not least is stress. Okay, so stress, either family related, work related, can actually predispose people to high blood pressure. Now, there are two terms that we normally use to describe high blood pressure. So number 1 is a hypertensive urgency, and number 2 is hypertensive emergency. So hypertensive urgency is when you just walk to the hospital, you've just gone there because of any other condition, and then when we check your blood pressure, we see that your blood pressure is just high, it's just on the roof, okay, above 180 millimeters of mercury for the systolic, and above 110 millimeters of mercury for the diastolic, but you do not have any symptoms. For you, you are okay, you don't have any symptoms that are suggestive of high blood pressure. That is hypertensive urgency. And then hypertensive emergency is when you present with symptoms that are suggestive of elevated high blood pressure, of elevated blood pressure. So these symptoms could be headache, dizziness, blurring of vision, confusion, okay, or chest pain that could be as a result of pulmonary edema, okay, or difficulty in breathing, or even fainting attacks, okay, seizures, okay, you name them, okay, and that will be high blood pressure, and the pressure is the systolic of more than 180 millimeters of mercury for the systolic, and more than 120 millimeters of mercury for the diastolic. So, some of the complications of high blood pressure include, number 1, we have already talked about kidney failure, okay, or what we call chronic kidney disease. You can develop stroke, and the stroke can either be ischemic or hemorrhagic. That is a topic for another day. And then you can develop heart failure, or even liver failure, okay. You can develop blindness, okay, as a result of hypertension. How do you make a diagnosis? Diagnosis can be made by regular checkup. It's good for you to just walk into the hospital once in a while, okay, once or twice in a month, and get your blood pressure checked, because that is the only way we can make early diagnosis. And early diagnosis means that we are able to manage the condition very well, therefore we can prevent, okay, the complications that come with persistently elevated blood pressure. So, how do we treat high blood pressure? So we have 3 components in the treatment of high blood pressure. Number 1 is lifestyle adjustment, okay? So with lifestyle adjustment, number 1, you need to shed off that extra weight that you don't need, okay? So you need to reduce your BMI. You need to maintain your BMI between 19 and 26, thereabout, okay? So you need to maintain your BMI within that area. So above 27, all the way to above 27, you need to try and shed off that extra weight, that extra fat, and you will be good to go. Do physical exercise, okay? For those who love smoking, please, you need to stop smoking, okay? And that will basically help to prevent and actually reduce the risk of you developing high blood pressure. So number 2 is nutrition, okay? So with nutrition, you need to try as much as possible to reduce Intake of a lot of salt. Okay, so for the lovers of nyama choma, if you go there and get your nyama choma, try and reduce the amount of salt that you take in. Okay, and as well, try and reduce a lot of processed foods that do not have any kind of nutritional value to you. Okay, try and reduce taking in a lot of fat and a lot of oil that has a lot of cholesterol, and that will go away. That will really help in reducing the risk of you developing high blood pressure. And then the other thing is medication. So we have different types of medications that we use in the management of high blood pressure. So number one are what we call the diuretics. So the diuretics, basically they help to reduce the amount of water in your body, and when we reduce the amount of water in your body, we also the water goes hand in hand with the salt. Okay, so we have different types of diuretics, like the loop diuretics, the thiazides, and the rest. And then the second type of medication that we normally use are the beta blockers. So the beta blockers, basically they help to dilate your blood vessels to be able to help accommodate, okay, the increased blood pressure. But they also help to reduce the heart rate or the heartbeat, so that so as to manage or to reduce your blood pressure. And then there are two types of drugs as well that act at the kidney level, and that is the angiotensin receptor blockers and the angiotensin converting enzyme inhibitors. Okay, and then the last group of drugs that are commonly used are the calcium channel blockers. Last but not least, this goes to the people who are who are already hypertensive. Okay, so if you are already hypertensive, you need to be able to attend your clinics regularly, because that is when we will be able to adjust your treatment plans to be able to fit completely, so that you are optimally managed for your high blood pressure and you are able to prevent the complications that come in with persistently elevated blood pressure. Now, for anyone who has probably a question about high blood pressure, please don't hesitate to comment down below. But also, you can follow us on our social media platforms, that is Zawadi Premier Hospital _Gong for Instagram and Zawadi Premier Hospital Gong for Facebook. And you can also subscribe to our YouTube channel, that is Doctor on Wheels. And you can also visit us at our hospital, that is at Luxil Center. That is at VET, opposite Yuanko Petrol Station. We are at the ground floor, and we will be able to take good care of you. We'll be able to manage you well, and you will be okay. Okay. So for more information, please don't hesitate to contact us. And God bless you so much. Until we meet next time.